This month on the Living Ladies podcast, we're talking about menopause. Hi, Doctor.
Hi, Amanda. So nice to talk to you again.
It is. Today we have a very interesting topic. Some people call it a hot topic because it's something that women go through. We all have to go through, and that's called menopause. And I have some interesting question for you to answer for us today.
Great. And I like how you said hot topic because, as you know, hot flushes occur with this.
Yeah. So let's get down to it. Let's start by defining what is menopause.
Menopause is when you stop seeing your period. And this happens when your ovaries stop releasing eggs. Therefore, you have no eggs remaining. And some women would also go into menopause if they have their ovaries removed.
What are the symptoms of menopause?
There are many, many symptoms, and there are the common ones, and then there are the atypical ones. So, the common symptoms of menopause are hot flushes, night sweats, vaginal dryness, low mood. That's a very important one. Not depression, but a low mood. Feeling anxious, joint and muscle pains, and loss of interest in having intercourse. So those are the most common ones. But then there are lots of atypical symptoms as well, such as digestive issues. People got bloating, indigestion, constipation, diarrhea, cramping. Some women get electric shocks throughout their body, muscle tremors, gum problems, and this occurs in 10 to 40% of patients, and they even get a metallic taste in their mouth. Tingling of the extremities, which is actually more common in the hands and feet, itching of their skin, hair loss, difficulty concentrating, weight gain, and this is due to a slowing of your metabolism, dizziness, brittle nails, allergies, which can sometimes only pop up in the menopause, irregular heartbeats, a change in their body odor, and this is due to excessive sweating. And more emotional issues will be things like irritability, depression, and panic attacks.
How can these symptoms be explained?
These are caused by a lack of estrogen produced by your ovaries and therefore fluctuations in their levels.
How can menopause be confirmed?
Menopause is confirmed in older women, which over 40, by their history of their periods. In younger women, it's confirmed by doing a blood test.
So, approximately at what age can menopause be expected?
Well, menopause is usually between the ages of 45 to 55, but the average age is 51. Now, this is based on United Kingdom data. We don't currently have true figures for Trinidad, but I have a few women in my office that actually are still not menopausal and they are 56, 57.
What are the phases of menopause, and is there anything significant about each phase?
So there's what women call premenopause. We medically call it perimenopause, then menopause, and then postmenopause. So perimenopause is after 40 up until your true menopause, and menopause is a date when you stop seeing your period totally. The diagnosis of menopause is when you don't see a period for one full year. So when you don't see it, you then look back and say your menopausal date was. And then postmenopause. So postmenopause is the continuing of the time after the true menopause. So women don't go through menopause and stop being menopausal. They are menopausal for the rest of their lives.
Is it possible for menopause to be triggered a bit earlier than expected?
Yes, some women go through what you call a premature menopause. And this could be due to many factors, such as if a lady has a hysterectomy and removal of their ovaries, then you go into menopause. But other ways of going into menopause is some women on chemotherapy or radiotherapy for cancers will also go into menopause because it actually basically shuts down your ovaries, or if you want to say it fries your eggs, Some autoimmune conditions can also cause a premature menopause. And there's chromosomal abnormalities, which is an abnormality that you're born with called Turner syndrome.
Now, I ask this question again because I've heard a lot of women say, I can't wait until menopause is over. But can menopause be considered over?
No, menopause is not over. When you become menopausal, you're menopausal for the rest of your life. However, some women get symptoms during the perimenopause, some get it at menopause, and some people get it postmenopausal, and it may just disappear. But the actual definition is that you remain menopausal for the rest of your life.
With regards to contraceptives, should they be discontinued after a woman's periods have stopped?
Because the definition of menopause is 1 year of no period, we advise for women who are menopausal before the age of 50 to use contraception for 2 years after their last period. Because we don't know if you have one or two eggs remaining, and that could actually come out and you can get pregnant. If you're over 50, then we recommend that you use extra contraception for 1 year and then you can come off of it.
What are the treatment options available for menopause?
Well, there are very many treatment options, ranging from just lifestyle changes, such as regular aerobic exercise, running or swimming, as well as low intensity aerobic exercises. Then there's non prescribed treatments, such as herbal medications, which we would call natural hormone replacement therapy. This consists of ingredients such as St. John's wort, black cohosh, and isoflavone. And these mainly help with the hot flushes and night sweats. However, we need to be cautious in using this because it can interact with other medications, such as medications for patients who are on anti-epileptic medications, as well as heart medications. So before you start any of these herbal medications, you should see your healthcare professional to make sure that's safe for you to use these. Other alternate treatments would be things like acupuncture and acupressure. Now, it has been shown to help, but we don't have lots of studies on this. So while women use it, we always say more studies are needed to prove this totally. Then there is medical hormone replacement therapy. I won't go into this today because that's a topic by itself about the risks, the benefits, and the other treatment options because there's so many debate around hormone replacement therapy and so many misinformation. So I want to do this at another time. There are also other non-hormonal medications, and many of them are heart medications that could treat hot flushes and night sweats. Then there's also psychological treatments, and this is called cognitive behavioral therapy, and this works for many women. So again, you should seek advice to see which treatment method is best for you.
Okay. And our final question relates to complications associated with menopause. What are some?
So most of these symptoms, they are not always complications, but worsening symptoms. One complication for sure is osteoporosis, which is thinning of your bones. So women tend to have get fractures after they stop having estrogen produced. The other worsening symptoms would be things like what we call pelvic organ prolapse. So you can have prolapse of your womb, where the womb comes outside. You can have prolapse of the bladder into the vagina, and also prolapse of the rectum into the vagina. Women tend to get memory loss, and some would say that, oh, this is linked to Alzheimer's, but that hasn't been proven. So it's more to just general memory loss.
And here is the actual final question.
Okay.
What would be one takeaway, firstly, for a woman who hasn't experienced the menopause phase as yet, and one takeaway for the woman who is currently going through it?
So just to let you know, ladies, that you are not crazy. Don't let anybody tell you that you are making up your symptoms because these are real and there are 34 symptoms of menopause. There are many treatment options. So don't feel like you have to go through this and it's going to be like this for the rest of your life. This is a natural process, but we all respond to it in a different way. So just for you to know, there are different treatment options and it can help. However, if it doesn't, don't worry because usually most menopausal symptoms can disappear without doing anything.
So, doctor, how can someone get in contact with your office?
So I work at Southern Medical, and you can call me. By direct numbers are 290-1249, and my assistant Natalie, it's 394-7528.
Okay. Thank you again, doctor, for the time you spent answering these questions. It's been really interesting and fun just listening to this information about menopause. And we look forward to hearing part 2 of menopause.
You're welcome, and I hope this helps women to understand that menopause is a natural process and nothing to be worried about.